We are now on the record. My name is Mitchell Reesboard. I'm a videographer retained by On the Record. This is a video deposition for Bergen County, New Jersey, number BER-L-007-340-19. Today's date is January 4th, 2023, and the time is 1:30 p.m. This deposition is being held in the matter of Ricky Barton versus Ramon Jimenez et al. The deponent is Joseph Altongy. All present counsel will be noted on the stenographic record. The court reporter is Corinne Kellner, and she will now swear in the witness.
Doctor, please raise your right hand for me, sir. Do you solemnly swear or affirm to tell the truth, the whole truth, and nothing but the truth?
I do.
Thank you, sir.
You may proceed.
Good morning, ladies and gentlemen of the jury. For the record, my name is Santos Perez, Ricky Barton. Does Mr. Merrigan want to enter his appearance?
Eamon Merrigan on behalf of defendant Ramon Jimenez.
Okay, Dr. Altongy, I will now proceed with asking you questions related to your expertise and the reason why you are here. First of all, for the benefit of the jury, will you please state and spell your name?
Joseph, middle initial F, Altongy. Joseph, Joseph, F, Altongy, Altongy, MD for medical doctor.
Thank you, doctor. And in fact, you correct?
Pardon me?
Doctor.
Is Mr. Perez breaking up, or is it just my end?
You are a physician, correct?
Let's go off the record, please.
Let's go off the record.
And by please, time is 1:31 off the record.
Recording stopped.
Time is 1:33. We are back on the record.
Dr. Altongy, you are in fact a physician, correct?
Yes.
In what specialty?
My specialty is orthopedic surgeon.
Okay, doctor, can you please give the jury the benefit of your education?
Yes. My college was Stevens Institute of Technology College in Hoboken, New Jersey. I graduated as Bachelor of Chemical Engineering in 1973. My graduate school was Princeton University of Princeton, New Jersey. I graduated in 1975 with master's degree of chemical engineering. Then my medical school is Rutgers, New Jersey Medical School, University Hospital, Newark, New Jersey. I graduated as medical doctor in year 1980. Then, after graduation as a medical doctor, I began my training for the specialty of orthopedic surgery. For orthopedic surgeons, the first year of training is in the field of general surgery. My 1 year of training in general surgery was at the Mount Sinai Hospital in New York City. That was followed by my 4 years of specialty training called orthopedic surgery residency. That was done in New York City at Columbia University Hospitals. In 1985, when I completed my residency in New York City, I am orthopedic surgeon. I then chose to add one additional year of training called fellowship in the specialty of pediatric orthopedics to add additional pediatric training to my plentiful adult orthopedic training. That year of fellowship training called pediatric orthopedics was done at the DuPont Hospital for Children of Wilmington, Delaware. That was completed in 1986. And in 1986, all of my training as an orthopedic surgeon for adults and children was finished, and I began my private practice in New Jersey.
Okay, doctor, so you graduated from Rutgers, New Jersey Medical School in what year?
May 1980.
And then you followed that with approximately 6 years of surgical residency, correct?
Yes.
Okay, doctor. You're currently licensed, correct?
Yes, New Jersey.
Okay, are you board certified in any area, in any
I am
field?
board certified in the area orthopedic surgeon.
Okay. Can you explain to the ladies and gentlemen of the jury, doctor, what do you do for a living? Do you work
Yes.
for a hospital or? Go ahead.
I worked from 1986 to 2022 as an orthopedic specialist in New Jersey. The first 30 years were in private practice, especially affiliated with Overlook Medical Center in Summit, New Jersey. And as an orthopedic specialist, I treated injuries and disorders of musculoskeletal. That would be neck, back, arms, legs, with the joints, muscles, ligaments, structures. In year 2018, after 31 years affiliated with Overlook Medical Center in private practice, it was time to close my practice, and I joined a group of physicians called Sol Myers Medical Associates, now in Elmwood Park, New Jersey, and I was an orthopedic specialist at that group, Sol Myers Medical Associates, from 2018 to 2022.
Okay, doctor. So you worked for 30 years in private practice, what you would call private practice, and then you are since 2018 working at or you worked at Sol Myers. Do you see patients there on a regular basis at Sol Myers?
Yes, during those 4 years, my responsibilities were 1 week was exclusively patient care of injured patients. Those would be my patients. Then the second week would be not patient care, but providing evaluations followed by report for injured persons treated elsewhere. So that would mean 50% of my weeks were my own patient care treatment, and 50% of my weeks were evaluation and reporting of persons treated elsewhere.
Okay, doctor. Prior to working at Sol Myers in your 30 years at Overlook Hospital, would you be able to estimate the number of patients that you saw?
Yes. I would estimate in a given week, say for the first 20 years of my career, I would see 50 or 75 persons at office visits, but I would see numerous at emergency room at Overlook Medical Center for their injuries.
Okay, and what type of injuries did your patients experience in general?
Most often they were injuries of the shoulder or the knee, and especially fractures of the upper limb and lower limb. Earlier in my career, combined with neurosurgeons, I managed fractures and injuries of the cervical spine and lumbar spine.
Okay, earlier in your practice, you managed.
Yes, I'll give this example. If there was a car accident and the lumbar spine was fractured, at Overlook Medical Center, it would be a neurosurgeon who was called to attend to that injured spine. If surgery was needed to remove bone fragments or disc material against the nerves, the neurosurgeon would do the decompression. At Overlook, I had experience doing the scoliosis surgeries for teenagers with spine curve. So I was experienced at putting in the internal fixation rods. So at the end of a trauma case of the lumbar spine, I would then put in the internal fixation and the fusion bone grafts along with the neurosurgeon. So that is my example of trauma care. That was not frequent, but it did happen.
Okay, doctor, and what percentage of your patients would you say experienced any back problems, meaning lumbar, cervical, or thoracic?
During my 4 years at Solmeyer's Medical Associates, 80% of the persons I treated had neck and back injuries, neck and back, and/or back pain.
Now, would you say you service primarily patients who have been involved in car accidents or sports injuries or some other type of injury?
During my career at Overlook, most were activity injuries or sports injuries. During my 4 years at Solmeyer's, the injured persons I treated were motor vehicle accident more than any other situation.
Okay, doctor, are you qualified to read diagnostics, MRI films?
As an orthopedic specialist, I'm experienced and qualified to read MRI films and
Do you have
imaging.
have you done so in your practice at either Solmeyer's or Overlook?
Yes,
Okay, with what frequency would you say you rendered your own opinion in reading films or imaging studies?
at Overlook,
At Overlook or Solmeyer's? No.
15 times per week. At
Okay.
Solmeyer's, more than that.
Okay. Do you have any hospital affiliations, doctor?
I completed my hospital affiliation with Overlook Medical Center in year 2021. My privileges there were no longer necessary.
Okay. And doctor, have you been the recipient of any awards for your work as a physician?
During my time at Overlook, was fortunate to receive numerous patient recognition awards.
Okay. I have no further questions, and I will now offer Dr. Altongy to the defense for cross-examination for qualifications.
I have no questions regarding the doctor's qualifications. Thank you.
Okay, so we can move on to the Dr. Altongy. I will now begin asking you questions related to the substantive questions related to the plaintiff in this case, Mr. Ricky Barton. Have you ever examined the plaintiff, Ricky Barton?
Yes, on 2 occasions.
Okay, and that was at my office's request, correct?
Yes,
And the purpose of your examination was for you to examine him and determine a causality, or what was the purpose of the examination?
my evaluation was to determine all of the circumstances of his injuries that happened on December 14, 2017, and then prepare a report of my findings, my diagnoses, and my conclusions about his injuries and the cause and the results.
Okay, doctor, did you in fact prepare such report?
Yes,
More than one or just one report?
2 reports for the 2 evaluations.
Okay, do you have those reports with you?
Yes,
Okay, and I just want to somewhat belatedly point out that Dr. Altongy's curriculum vitae will be submitted as plaintiff Altongy 1, and his 2 reports or 3 reports will be submitted as plaintiff Altongy 2, 3, and 4. Now, Dr. Altongy, going back to these reports, when was the first time that you saw Dr. or plaintiff Ricky Barton?
my first evaluation was on April 25, 2019.
Okay. As part of that evaluation, doctor, were you provided with the documentation?
Pardon me?
As part of that examination on April 25th of 2019, Did you also review medical records for plaintiff Ricky Barton?
Yes,
Okay, would you be able to either summarize or itemize what medical records you review in conjunction with that April 25th, 2019 examination?
yes. The most important items that I reviewed during that evaluation were 2 reports by Dr. Jeffrey Jacobs, an evaluating and treating chiropractic specialist for his neck and back injuries after this accident. And the other important items that I reviewed were MRI studies of injured neck, cervical spine, MRI study of injured lower back, lumbar spine, and I reviewed the reports by treating physicians called pain management specialists who perform procedures in an effort to improve the circumstances of injury, especially lower back injury. And I can talk more about the details of those reports that I reviewed.
Okay, doctor, thank you. And in addition to these reports, did you also obtain an oral history from Ricky Barton?
Yes,
Okay, and can you please explain to the, you do have that report in front of you, correct? It's a report dated March 23rd, 2021. Is that the report you rendered as a result of this visit
yes, the
in
report is
April
dated
25th?
May 21, 2019, when my company transmitted the report, and it's listed as my date of
Okay.
examination, April 25, 2019.
Okay. Now, what were your findings, doctor, in terms of any injuries that plaintiff Ricky Barton suffered as a result of the accident of December of 2017, December 14th of 2017?
He told me his injuries from this car accident were at his neck and back. He gave me the history that he received care from Dr. Jeffrey Jacobs, chiropractic specialist. He told me that he received the MRI studies of neck and back, and that he had care and procedure treatments by pain management specialists who were first Dr. Alexander Zaitsev and then Dr. Alan Weissman. Then he told me the difficulties are ongoing at neck and back. And this was on the date of evaluation, April 25, 2019. Then I performed my own physical examination of his injured neck, cervical spine, of his injured lower back, lumbar spine.
And what were your findings, doctor, with regard to that examination?
Yes, at his neck, cervical spine, my most important findings showed injury. At his neck, when viewed from the side, we have a curved slope. With injured, damaged muscles, injured muscles become hard and tight, and as a result, he lost that full lordosis slope. That was my first finding. My second physical finding is touching the muscles, they're hard, rather than the softness of other muscles about his body. When muscles are damaged in trauma, muscle fibers tear, and our body makes fibrous tissue to replace the injured muscle. And unfortunately, vehicle accidents are forceful enough to tear muscles of the cervical spine. The other thing is At our neck, cervical spine, there are many small joints that allow us to move in so many directions. Those joints are traumatized. And the ligaments that connect the joints stretch. The cartilages that let the joints glide, collide, and they develop. A person injured in this way develops pain. And when you poke deep at the facet joints, certain facet joints will not elicit a pain response, but it is mid and lower cervical spine they did. And so facet joint pain, FACET joint pain, was part of my physical exam. The other part of my physical exam is having him sit facing me on the exam table while I instruct him in his range of motion. And of course, range of motion is a cooperation of the injured person and the physician. So I know how to encourage his best effort at moving. And I asked him to move in the following directions: in the extension position upward, the flexion position downward, the turning position, rotation, the turning position. He lacked, even with encouragement and urging, the expected amount of motion of a man in his age group. So then one of my most important physical findings of his neck is stiffness. Those were my findings. His neck pain moved from neck area towards both shoulders. And that concluded my neck, cervical spine physical exam. Next, yes?
Go ahead.
I put my attention on examining his lumbar spine. For exam of his lumbar spine, I asked him to stand, and I view from the side. From the side, we have this natural lordosis curve slope. His was not the correct or average or expected amount for his age group. There's decreased lordosis, which tells me also muscle injury. When I touch the spinal muscles of his lower back to the right and the left of the midline, there's hardness showing injured muscle fibers compared to the softness of the touching of muscles of other places. Then for range of motion, it has to be Mr. Barton and myself working together. Then I encourage him to give the most he can of flexion, which is bending forward, of extension, which is bending backward, then of rotating and turning to right and left. Then I recorded that there was decreased range of motion compared to the usual expected. And so my physical finding conclusion is stiffness. Then I placed them on the exam table, lying flat on the exam table, facing upward. And when I pull on his legs are straight. When I move them upward, I should be able to move them gradually without his resistance or back pain. This is also requires Mr. Barton and myself working together, and his legs could straight leg raise less than I would expect for a usual man in his age group. Those were my physical examination findings, which tell me there has been injury and damage to neck, cervical spine, and injury and damage to lower back, lumbar spine.
Doctor, now you testified that you reviewed operative reports by Dr. Alan Wiseman, correct?
Yes,
And operative reports by Dr. Alexander Zaitsev, correct?
yes. The reports were provided to me, and I was able to see the full procedure report.
Can you,
in all those cases.
are these procedures consistent with your physical findings of plaintiff Ricky Barton?
Yes, the treatments used make sense to me. They match with the physical findings and the injuries that I know have happened.
Okay. For the benefit of the jury, doctor, would you be able to summarize what these procedures were by Dr. Alan Wiseman and Alexander Zaitsev?
Yes. In April, May, and again in May, Dr. Alexander Zaitsev performed 3 procedures done by pain management specialists in an effort to reduce pain. Eliminating is not possible, but reducing makes a person suffer less and their movements and function might be more. The first procedure done by Dr. Zaitsev was lumbar epidural steroid injection. Epidural steroid injections are done for the purpose of lowering the pain of what's called nerve roots. The spinal nerves travel down our spine, then from our lower back, the spinal nerves travel to the right leg and left leg. Because as we'll say later from the MRI when we get to it, there is herniated disc, it's pressing on nerves. It's pressing on the nerves that go to the legs. And the epidural steroid injection treatment was done bilateral. That means the doctor injected steroid medicine to the epidural space on the right and steroid medicine to the epidural space on the left in an effort to reduce spinal nerve pain. Then that doctor performed 2 other procedures, not directed at spinal nerve pain, directed at pain from the small facet joints that I mentioned. Facet joints, F-A-C-E-T, are those complicated joints that let us move in so many directions. As I said, when those joints are traumatized, the ligaments connecting the bones are harmed, the cartilage that should allow smooth, pain-free gliding is traumatized, made rough, and those facet joints are painful. Yes, I know this man has damage to the facet joints as well as disc damage. The second and third procedures done by Dr. Zaitsev were directed at the facet joints. Dr. Zaitsev, did 1 procedure at the facet joint after he had earlier done 1 procedure at the nerve roots. It was Dr. Alan Wiseman later in May, September, and October that continued the work that's a sensible procedure and a sensible sequence to manage facet joint pain. This doctor, Alan Wiseman, also pain management specialist, continued the treatment by doing lumbar, lower back, facet joint blocks, bilateral. That means he injected anesthesia medicine at the sensory nerves, not nerve roots, small sensory nerves that supply the facet joints. He did it bilateral, which means right and left. And he targeted his facet joint nerve blocks at the joints called L3, L4, L4, L5, and L5S1 on the right and on the left. And that makes sense to me because I know from my exam, there has been facet joint harm in those locations. Facet joint harm gives pain to the lower back, but it gives stiffness and tightness to the lower back. Then after that procedure for the facet joint blocks, it's a sequence of 3 treatments. That was the first treatment. The second treatment was at those same facet joints, the sensory nerves are taken away by something called radio frequency denervation. It's to try to eliminate the sensory nerves so they cannot as well transmit pain. So the doctor did left facet joints, L3, L4, L4, L5, L5S1. Then 1 month later, he did the same radio frequency denervation of the small sensory nerves to those same joints on the right side. All of these treatments by those two pain management specialists are usual. To me, they're sensible, helpful. They cannot undo damage. They try to help a person lower pain, lower suffering, because then the person might be able to move better or function better. And those were all of the treatments that were provided to Mr. Barton at the time of my first evaluation that was done April 25, 2019.
Okay, doctor. Now, is a denervation the same as a rhizotomy?
Yes.
Okay, and you
Denervation,
testify.
ablation, and rhizotomy are the three most frequent words meaning the same thing.
Okay, and you testified something about eliminating the nerve roots. Can you explain to the jury what that means?
They are not the nerve roots. The nerve roots are larger nerves that leave our spine and from our neck go to our arms, from our lower back go to our legs. This is trying to eliminate small sensory nerves that provide sensation to those specific joints. Of course, all of our joints, shoulder, knee, they all have sensory nerves. Sensory nerves are pain producing if something's wrong. So it was denervation of small sensory nerves. That is not a treatment of the larger nerve roots that go to the right leg and left leg.
And doctor, how are these nerves eliminated?
I don't know the methods but I know it's a radio frequency method, not a burning heat method. So you would not call it burning of the nerves.
Would you say, doctor, that these treatments, meaning the facet joint blocks, the radio frequency denervation, the denervation rhizotomies, are they permanent or temporary in nature? Do they provide
Temporary.
temporary?
Provide some relief, but they cannot change the damage to the joints. And there are too many sensory nerves surrounding those joints. These are important treatments by pain management doctors, but they are temporary treatments. Epidural treatments to lower nerve root pain are temporary. Nerve blocks and denervation radio frequency methods are efforts to reduce pain, but they are temporary.
Okay, doctor, and why is a rhizotomy temporary when you eliminate the small nerve?
It
Is
is not
that
the
not
only
permanent?
nerve. It is not the only nerve that supplies sensation to the complicated facet joints.
Okay. Now, doctor, you also reviewed in conjunction with this particular examination of April 25th, 2019, MRI studies, correct?
Yes.
Can you summarize these MRI studies for the benefit of the jury, please?
Yes. It's important to mention that they were ordered by the chiropractic physician, Dr. Jeffrey Jacobs. In reading his notes, his first evaluation of Mr. Barton was January, the month after the accident. And these MRI studies happened in March, which tells us that in the first several months after the accident, there was too much difficulty to forego MRI tests, and it's sensible that Dr. Jacobs ordered those tests. The MRI magnetic resonance image test of the cervical spine, neck, and lumbar spine, lower back, were done on the same day, March 6, 2018, at Cliffside Park, New Jersey Imaging Center. And the radiologist who prepared a report is named Dr. Chess. The most important finding of the cervical spine MRI is disc herniation of the disc called C6, C7. Now I'll explain what a disc is. At our neck and the whole length of our back, we have bones, joints, muscles, and ligaments. Vertebral bodies are square bones, one on top of the other, of our neck and back. Of course, if the bones were touching bone, they couldn't move well. So we were given this very specialized shock absorber, we can call it, called intervertebral discs. They're cushions, shock absorbers, and they control motion between the levels of neck and back. So for example, a disc cushion between cervical spine bone number 3 and cervical spine bone number 4 would be called intervertebral disc C3, C4. And there are discs in all those locations. Those disc materials are so amazing that they can take motion, shock, activity. When uninjured, they allow us to do so much. Then this study showed one of the discs called C6, C7, the disc cushioning between cervical spine disc, bone number 6 and bone number 7 is herniated. I have to explain what the disc is. It's this oval-shaped cushion between the bones. The outer part of the disc are very tough ligaments, just like other ligaments that connect bone, but the ligaments are in numerous ovals or circles, so that group of ligaments is called annulus fibrosus. In the center of the annulus fibrosus is a very specialized material that can take shock called nucleus pulposus. When the annulus fibrosus ligament circling fibers are not injured, they contain the nucleus pulposus in exactly the correct place. Then I'll mention this. When some injury happens, abrupt, the circular ligament fibers with normal movement move fine, but with abrupt, some of the circling ligament fibers rip and tear, and that allows the central nucleus pulposus material, which is under pressure, to escape its position. Then when it escapes its position, it's called herniated disc. Herniated disc happened because of this accident at the neck at level disc C6, C7. And from my observation of the report of the disc images and matching the radiologist's report, it's impinging on thecal sac. THECAL is the anatomy name of the container that holds the spinal cord of the neck and the spinal nerves. So this study says there is a herniated disc injury and it's pressing on the structure that holds nerves. There is not findings of degeneration. Some persons in the 50s have degeneration of the disc areas, some do not. These findings are injury findings. That's my summary of what I noticed, so similar to what Dr. Chess noticed from the cervical spine MRI after this accident. The lumbar spine, lower back MRI study, as I said, was done on the same day. And it showed disc herniation also. This lower back disc herniation is at the level L3, L4. It is the intervertebral disc called disc, D-I-S-C, L3, L4. And when the disc material moves out of its correct position, it moves and occupies spaces where the nerve roots live. The nerve roots are the important nerves that leave the spine and at lumbar go to the right leg and left leg. They contain sensation of the upper leg, lower leg, and they contain the motor control. And they contain pain fibers. And at lower back, the disc herniation of disc L3, L4 was impinging upon the closest nerve called nerve lumbar 3. It's putting pressure on that nerve on the left. And on the right, displaced disc material is occupying the space on the right, the foramen is the exit space. So that would mean, as expected, herniated disc material occupies space where it should not belong. It occupies space where nerves want to have their clear pathway. So in this case, the lumbar MRI showed herniated disc injury and encroachment upon nerves and nerve spaces, nerve root spaces. Those were the findings of the cervical spine, neck, and lumbar spine MRI, March 2018, resulting from the accident of December 14, 2017.
Okay, thank you, doctor. Now, you stated that you testified that these findings in these diagnostics and these MRIs were the result of injury and not degenerative.
That's correct.
Is it your testimony then that these anomalies were caused by the December 2017 accident?
Yes,
Okay. Were these findings consistent with your examination and observations of Ricky Barton at your office?
yes,
Can you explain to the jury how?
yes. We'll begin with disc herniation. When the disc material is where it should be and the discs are not injured, we move so well without difficulties. With disc herniation causes pain because there has been ripping of the annulus fibrosus ligaments and which have nerve endings, and the disc material displaced presses on nerves. So in certain motions, the disc material is bumping and bruising the closest nerve roots. Usually all of our motions create no impingement or collision. So it's an impingement of nerve roots.
Okay, doctor. So that in the case of the L3-4 intervertebral disc impinging on the left nerve root, this can be expected to result in pain, correct?
Yes. And as I said in my findings, the pain goes towards the upper part of the legs. This is not the disc location that is near the nerves, is closest to the nerves that go to our lower leg, but it goes to our upper leg. If our upper leg suffers and can't work correctly, our entire leg cannot work correctly.
Okay, doctor, thank you. As a result of this examination, doctor, and as a result of your review of the MRI studies, along with the operative reports for the rhizotomies and the facet joint blocks, did you arrive at a conclusion on causality?
Oh, yes. We know he had no difficulties prior to this accident. His work related to construction was normal and successful. I know that the causality is these injuries and difficulties of cervical spine and lumbar spine are due to the motor vehicle accident of the December 17. December 14, 2017.
And doctor, did you arrive at a conclusion regarding permanency and prognosis?
Yes,
Would you please recite that?
yes. The disc material that's dislodged from cervical spine and lumbar spine does not go back into place. The facet joints of neck and back that also make pain and stiffness are damaged, and unfortunately, they cannot heal to their pre-injury status. The pain situation and the loss of function, loss of motion, loss of activity, these are permanent. Then in my prognosis, I stated in my report that based on what I noticed, unfortunately, there will be more treatment needed, not to reverse the injuries, that's not possible, but to try to respond to difficulties. So I said in my first report, additional treatments such as epidural steroid injections to temporarily lower nerve root pain, and even surgical treatment to remove the herniated disc material impinging on nerves, that those treatments may be necessary.
Okay, doctor, so on May 21st of 2019, pursuant to your examination of April 25th of 2019, you concluded that plaintiff Ricky Barton may in fact be subjected to surgery in the future, correct?
I said additional treatments, including surgery, may be possible in his future.
Okay, and in fact, doctor, you issued a second report dated March 23rd of 2021. Do you have that in front of you?
Yes, I do.
Okay, do you recall what the purpose of that examination was?
Yes. My report was issued to you March 23, 2021, for my evaluation that was done the previous day, March 22, 2021. The purpose of that report is the difficulties that I was aware of in my first evaluation were ongoing. They were ongoing, which led to more evaluations and led to more treatments. From my first visit to the second visit, the difficulties worsened and pain management injection treatments were used in an effort to reduce symptoms. And when they were temporary and not sufficient, disc surgery was performed at the lumbar spine for removal of the herniated disc. So that would mean my reevaluation, my new report is important to provide the ongoing circumstances that were happening beyond my first report.
Okay, doctor. Now, were you provided with new medical records for that evaluation, doctor?
Yes.
Would you be able to summarize them or itemize them?
I was provided with MRI studies for my own review and MRI radiology reports for the second set of MRI studies that were done of the cervical spine and lumbar spine. And I was provided with detailed, numerous office and procedure reports by a specialist named Dr. Stephen Waldman, who continued the management of the cervical spine and lumbar spine injuries and difficulties. I have Dr. Waldman's reports of office visits that I read. I have Dr. Stephen Waldman's reports of pain management injection treatments he did. Then I have his report of an important procedure called discogram of the lumbar spine that we'll talk about. So important in decision-making. Can surgery be potentially helpful? And if it can, where should the surgery be directed? So I have Dr. Waldman's discogram report, and I have the report of Dr. Waldman's lumbar spine surgery and disc removal. I also have his report after the disc removal summarizing his diagnoses of the injured places.
Okay, after the disc removal, would you explain what that means, doctor? For the benefit of the jury?
Disc removal surgery, most orthopedic surgeons and neurosurgeons and pain management spine specialists are cautious, which means frequently there's a long sequence of trying measures less than surgery to help the person. Because his lower back pain was persistent, even worsening, Dr. Waldman considered surgery to remove the disc. It cannot put the disc back in place. So this disc is deficient and cannot work correctly, but it's to take the disc pressure off the closest nerve roots. So that would mean with the patient face down on an operating room table with a small incision, he would use exposure tools to remove carefully the dislodged disc material. With larger disorders affecting many discs, sometimes several discs are removed and then hardware is put in by orthopedic surgeons. That's very invasive, not needed in this case. And I agree with Dr. Waldman that that was the most surgical intervention that could give the greatest benefit. Then I need to mention that I know Dr. Waldman was thoughtful in his decision to hold off on surgery or to perform surgery.
Now,
Dr.
doctor,
Waldman
go
had
ahead.
already performed epidural injection in an attempt to, in a non-surgical way, add some additional temporary relief. But at this time, Mr. Barton, not only back pain, but with nerve pressure, his left leg could not support him well. That we know from the records. And when a nerve is under pressure that supplies even the upper part of the leg, even men in their 50s have often struggled to walk around. They might use crutches, they might use cane. He struggled. So Dr. Waldman wanted to help him with disc removal. Before he did disc removal, he did an important procedure called discogram. And I read the procedure report of Dr. Waldman. Discogram means in an outpatient surgical procedure, but not asleep, the pain management specialist injects liquid into the disc spaces. This doctor injected liquid into the disc space L3, L4 to a disc space above and to 2 disc spaces below. This is an objective test. When it produces pain, it's clear. With or without the person telling you, you will note the person movement and the pain response. So when Dr. Waldman injected pressurized liquid into the one above, not injured, L2, L3, it accepted 50 pounds of pressure with no pain response, no difficulty. So L2, L3 discogram is then named normal. At L3, L4, not with 50 pounds of pressure, with 20 pounds of pressure, there is a clear pain response. Positive, showing that the L3, L4 disc level is pain producing. Then he did L4, L5, 50 pounds of pressure, no trouble. L5S1, 50 pounds of pressure. So he was very thoughtful in finding out, is L3, L4 a pain producing level? And it was. And that then, with the physical difficulties and the discogram material, tells me that Dr. Waldman was sensible and appropriate in recommending and proceeding with the disc removal surgery that was done.
So, Dr. Altongy, then, so your testimony is basically that Dr. Waldman performed a discogram,
Yes.
correct? And based on that discogram, which you call an objective test, correct?
Yes.
He decided that Mr. Barton should undergo surgery, correct?
Yes.
And Mr. Barton did in fact undergo the surgery, correct?
Yes.
Now, when did this treatment take place, including and the treatment, I mean, the discogram, the surgery, as well as the epidural injections which preceded these procedures?
I have that here. November 12, 2019. Dr. Waldman did lumbar epidural steroid injection. As we said, the epidural steroids are aimed at nerve root difficulties. Then he did a month later, December 17th, 2019, a cervical spine, neck epidural steroid injection. That would mean lower back has created the greatest limitation to function, but neck is also injured, and that was the choice of Mr. Barton and Dr. Waldman in an effort to receive some relief of neck symptoms. That was a neck epidural treatment. Then, February 18th, 2020, Dr. Waldman did nerve block procedures, not to those little facet joint nerves that we talked about before, but nerve block, which are just placing anesthesia medicine near the actual nerve roots. And he selects what nerve roots he feels need the most relief. This is also telling us he's being cautious, not so surgical at first, in how he's trying to help this person. Then, by June of 2020, there's still too much difficulty. Dr. Waldman says continued lower back pain, but worsened over the several months prior to June of 2020. And so then Dr. Waldman is recommending the discogram in order to determine, can he recommend surgical discectomy? The discogram was performed July 30, 2020. And I gave the findings that three discs tolerated 50 pounds of pressure with no positive findings, whereas one disc could not, at 20 pounds of pressure, was positive for the pain response. Then, the next month, August, at an office visit, and I read the office visit notes, Dr. Waldman recommended lumbar disc surgery. I read the operative report. The surgery to remove the disc happened November 5, 2020, where Dr. Waldman performed the procedure and he did L3, L4 discectomy. Complete annular tear was one of his findings, which matches with what I expected. The injury has torn through all of the annulus fibrosus ligament fibers. Then annuloplasty is some burning method to try to close over that defect so that any additional disc material might not escape. That was the date, November 5th, 2020. Then, at a follow-up visit in the office, I read Dr. Waldman's note, November 13, 2020. Yes.
Stand by, please. The time is 2:29 off the record.
Recording stopped. Recording in progress.
Time is 2:34. We are back on the record.
At Dr. Waldman's office note of November 13, 2020, which was after the operation of discectomy a week before November 5th, Dr. Waldman's conclusions, he has his conclusions, but they match my conclusions from evaluating this case. Dr. Waldman final diagnoses of these injuries are L3, L4, known disc herniation, status post L3, L4 discectomy, and C6, C7 disc herniation. And in his different office notes that I read, Dr. Waldman has concluded that the injured places are the same places that I know are injured. Dr. Waldman uses the word, the difficulties of cervical spine and lumbar spine are discogenic injury. That's a fancy name for disc injury is making trouble. And he said there is facetogenic injury. That means the facet joints are damaged. And those are the same as my conclusions. The discs, there is a herniated disc of cervical spine, a herniated disc of lumbar spine. There are facet joint damages of cervical spine, neck, and lumbar spine. So that would mean, while I have not met this doctor, everything he described makes full sense to me, and I agree with it.
Thank you, Doctor. Dr. Altongy, did you come to a conclusion on causality regarding this November 2020 discectomy and the December 2017 accident?
Yes. Everything I've read from my first evaluation and my second evaluation points to the fact that he was uninjured entering the second accident. The first accident of December 2017. That first accident caused cervical spine, disc herniation, and facet joint injury. It caused lumbar spine, disc herniation, and facet joint injury. The disc herniation, especially of lumbar spine, caused nerve root pain and dysfunction, left leg worse than right leg. A second accident happened, but I have read the fact that in several months before the second accident, July was the second accident, 2019. In April 2019, Mr. Barton went to Holy Name Medical Center emergency room with increasing back pain and pain to his left leg that he was hobbling on left leg. Those were some of the same remarks that Dr. Waldman made. So that would mean the April visit tells me that all of these difficulties are ongoing. Then a second accident happened, but the photographs of two vehicles were sent to me, and I saw the back of his vehicle, the front of another vehicle, and instead of some damage, there was no damage. And Mr. Barton told me all of his difficulties were ongoing. So I know that the first accident caused all of the damage. In my second report, all of the injuries are the same. On MRI studies, on notes, they are at the same levels, the same locations. So it is my conclusion that the damages, the treatments, the surgery, and the ongoing difficulties are 100% causally related to the first accident of December 2017.
Just for clarification, doctor, so that your testimony is that Mr. Barton had no injury prior to the 2017 accident, correct?
Correct.
And that he visited the ER in April of 2019, correct?
Yes.
And you said something about a subsequent accident a couple of months after that ER visit, correct?
Yes, which is a subsequent event is in my second report.
Okay, doctor. And you testified that you don't believe that that second accident was responsible for any of the anomalies that Mr. Barton suffered because of the nature of the accident, correct?
Correct. The anomalies after and the anomalies before are the same.
Okay, and doctor, in fact, were you provided with pictures of the second accident?
As I mentioned, yes, I saw the back of one vehicle and the front of one vehicle, and I did not see any damage.
Okay. I believe we have plaintiff Altongy 1, 2, 3, and 4. So that what I'm going to do is do a share screen for plaintiff Altongy 5, which constitutes 2 pictures of that were provided to Dr. Altongy.
What was exhibit 4?
The MRI review, the addendum regarding his review of the MRIs films.
Which is dated what?
It's dated July 14, 2022.
Thank you.
You're welcome. Let me just go back here. Okay. Now, can you see a picture of, can everyone see the picture of two vehicles?
Yes,
Okay, now just to clarify, Dr. Altongy, I'm showing what has been marked as exhibit plaintiff Altongy 5. You were not at that accident, correct?
no,
So that you can't authenticate these pictures, correct?
no,
Okay, but in fact, you were provided with these pictures, correct?
yes,
Now, assuming these pictures, in fact, accurately depict the July 23rd, 2019 accident, what are your observations with regard to the nature of the accident?
I see the back of a Hyundai vehicle, light blue or light gray, and I don't see any harm. I see the front of a Toyota vehicle, light gray, and I don't see any vehicle harm.
Doctor, if in fact these images are accurate, would you characterize that as a severe accident?
No, I would
Is it
not
a
use the word severe.
Is it a significant accident?
Most likely, it is not a significant accident.
Okay, now,
Just note my objection to those 2 questions with a motion to strike.
Doctor, now, this accident occurred on July 3rd, 2019. Were you provided with a police report?
I don't remember.
Doctor, you said something about an ER in April of 2019, correct, by Ricky Barton?
That I know about. I received his discharge instructions,
Okay,
which told me he had reason to go to emergency room at Holy Name that day. And the discharge instructions told me that they evaluated him and made a ER diagnosis of lower back pain with radiculopathy. That was their diagnosis. But it tells me he went for a back difficulty.
okay. Off the record?
Stand by, please. The time is 2:44 off the video record.
I just want to try
Recording
to
stopped.
just give me some time to try to get the screen share off. My apologies.
Recording in progress.
Time is 2:44. We are back on the record.
Now, Doctor, in your report of March 23rd of 2021, you indicated that you reviewed some records by Dr. Stephen Waldman. And in addition, there's a review of a January 23rd, 2020 record from Dr. Stephen Waldman at the Interventional Spine and Surgery Group. And do you have that particular reference to that report in front of you? Page 7?
Yes, January 23, 2020, Dr. Stephen Waldman, follow-up
Okay.
evaluation.
where the paragraph under that heading, which states physical examination. Would you
Yes.
please read the first two sentences?
Dr. Waldman wrote, antalgic gait. He was almost dragging his left lower extremity.
Would you please explain to the jury the significance of this finding?
Antalgic gait is a physical difficulty where we are able to place weight on one limb, but not well on the other. So we try to spend as much time on the well leg and to move as quickly as possible off the opposite suffering leg. That's Dr. Waldman's description of the injured person's appearance on that date.
Doctor, does this finding correlate with the November 2020 discectomy?
Yes,
How so? How so?
the disc material that's dislodged, called herniated disc. These are clinical demonstrations of the nerve pressure caused by the herniated disc. So while a discectomy cannot bring him at all back to the beginning, it's very important to do the most possible, which is to take disc material off the nerve and reduce the nerve pressure.
Would you say that this observation that Mr. Barton was almost dragging his left lower extremity supports Dr. Waldman's decision to perform the surgery?
Yes,
Okay. Now, going further down, Doctor, at page 10 of your report, you
Yes.
indicate that you reviewed an August 17, 2020 follow-up evaluation from Dr. Stephen Waldman, interventional spine and surgery group, and the paragraph which begins with history of present illness. Would you please read the last sentence?
I have it. It says, unfortunately, he continued to report lumbar pain 7 out of 10 on the pain score and radiating to both buttocks and down the legs, left more than right.
Is that of significance in terms of the decision to perform the surgery at L34 by Dr. Waldman?
Yes, I think removing the disc, one of the hopes is back pain can at least lessen, but more important than that is relieving nerve pressure that harms leg function.
Does this observation that the pain continued to, that the patient continued to report lumbar pain, left more than right, support the decision to perform the surgery, the November 2020 surgery?
Yes,
Doctor, you indicated that you had read the MRI films of 2018, correct?
yes,
And that you noted an anomaly at L34, correct?
yes,
With nerve root impingement at L34, correct?
yes,
Would that objective finding support a decision to perform a surgery, the November 2020 surgery, the discectomy?
yes. That means that right from the start, disc herniation encroached upon nerve and nerve spaces, and it did not subside.
And in fact, on that same page, where the paragraph which begins with the bold heading diagnostic review, you indicate that an MRI of the lumbar spine was performed post-discography.
Dr.
And-
Wall indicated that.
Correct. That is correct. And the last sentence, it states that it revealed L34 internal disruption. And then at the end, it says with nerve root impingement. Is that consistent with the MRI of 2018?
Yes, and it said This MRI of July 30th, 2020, left-sided herniation, and it with nerve root impingement. The 2020 MRI is consistent with the 2018 MRI.
And doctor, you did read the films for the 2018 MRI, correct?
2018
images.
and 2019.
Did you formulate an opinion on prognosis, Dr. Altongy, regarding this particular examination?
Yes, after my second evaluation, my conclusion is the harm to his neck, lower back, facet joint damage, disc damage is permanent, and he cannot heal to how he was before, and his difficulties of pain and lessened function are permanent.
Doctor, did you have sufficient medical records to conclude as you just did?
Yes, I believe I was given very proper and abundant medical records to draw my conclusions.
Are your conclusions made within a reasonable degree of medical certainty?
Yes,
Does that include your opinion regarding the first IME, your first evaluation of May 21st of 2019?
yes,
And Dr. Altongy, just for the benefit of the jury, would you please explain the difference in treatment that Mr. Barton underwent in 2018 versus the treatment that he underwent in 2019 and 2020?
yes. In 2018, the pain management type treatments made sense because as practitioners, we're hopeful that methods that are low invasive can make a benefit. So in 2018, the lumbar spine injuries were treated with one lumbar steroid injection, which is meant to try to lower the nerve root pain. The nerve roots are the larger nerves that go to the legs. Then several treatments were done to try to lower the pain of the damaged facet joints. After Dr. Waldman began the management, he also began at the lumbar spine with, I'll check. Yes, in November 2019, Dr. Waldman began with a lumbar epidural steroid injection. That's meant at trying to reduce the suffering of the nerve roots. He did not direct his treatments at the facet joints. That had already happened by the first group of doctors. He directed his treatments at what he was observing to be ongoing and worsening difficulty of disc displacement. For cervical spine disc displacement, Dr. Waldman did one cervical spine epidural injection. For lumbar, he did the one lumbar epidural injection. When the difficulties continued, he was knowing that surgery was needed. He did the discogram and it told him surgery was appropriate and the exact location matched with the expected pathology findings of the MRI test. Then he did a surgical treatment. So the treatments by Dr. Waldman were directed at nerve root pain and compression.
So Dr. Altongy, just so the jury understands, your testimony is that for the first accident, the treatment and the injury corresponded to facet joint injury, correct?
And lumbar disc herniation injury.
Okay, and after the treatment that Mr. Barton underwent in 2019 and 2020 was directed primarily at disc displacement, correct?
Yes,
With corresponding pain.
yes,
And it is your opinion, within a reasonable degree of medical certainty, that the treatment, my apologies, which Mr. Barton underwent in 2018, was causally related to the 2017 accident, correct?
treatments in 2018 are causally related to the 2017 accident. Yes,
Okay, and it is also your testimony that the treatment which Mr. Barton underwent in beginning in or about November 2019 through approximately November of 2020 was also related to the December 2017 accident. Correct?
yes. I'll say why. The pathology that was managed all throughout was the same pathology that happened right from the beginning. I have no information that the second accident contributed to the difficulties. So I can't estimate or judge the second accident did this or that. It's possible the second accident did zero. It's possible the second accident did something. But I know for sure the first accident caused the pathology that made difficulties and management all alone. That's why, rather than estimating, I have to say that I attribute 100% of the ongoing difficulties, the physical damage, and the treatments used to the first accident.
Doctor, would you say that the MRI of 2018, which found nerve root impingement at L3-4, would you say that constitutes objective evidence for the November 2020 discectomy performed by Dr. Waldman?
Same location, same pathology, yes.
No further questions. Thank you, doctor.
Good afternoon again, Doctor. My name is Eamon Merrigan. I represent the defendant in this action. I do have some questions for you. So as we sit here today, I believe it's January 4th, 2023. We're over 5 years after the car accident that we're here for of December 14th, 2017, correct?
Yes,
And over 3 years after Mr. Barton's subsequent accident of July 3rd, 2019, correct?
yes,
And during the intervening 5+ years since the first accident, Mr. Barton was seen by a variety of medical providers and treaters, correct?
yes,
And you are not one of those treating physicians, correct?
that is correct.
You were hired by Mr. Barton's attorney.
That is correct.
And since being hired by Mr. Barton's attorney, you've issued the 3 reports that are marked as exhibits, correct?
2 were evaluation reports. 1 was a statement of my MRI inspection.
And obviously you're here testifying for this lawsuit today, correct?
Yes, yes.
How much were you paid for your first evaluation and report regarding Mr. Barton?
During those 4 years at Solmeyer's Medical Associates, I received the same monthly salary and I did not participate in billing and receiving, so I don't know the amount that was sent to the Solmeyer's Medical Associates.
You have no idea how much Saul Myers was charging for you to examine Mr. Barton and issue a report to his attorney?
Correct, and it's best that I did the medical part and did not participate in the billing, receiving, or looking at the results of billing and receiving.
Until 2018, you had your own private practice, correct?
Yes,
Did you do this type of legal medical work while you were at your own private practice?
no,
When you joined Saul Myers in 2018, you started doing this type of work, correct?
yes,
And you estimated earlier that approximately 50% of your work at Saul Myers was this type of work.
yes,
And Saul Myers, at least according to their website, seems to indicate that they specialize in accident injuries for some reason. Does that sound accurate to you?
Yes, you would call this a forensic medicine medical practice.
What does that mean, forensic medicine?
That means the patients that are sent to us by attorneys because they've had injury involving litigation, which means I'm treating the patients to help them the regular way a physician would. But I also know when I'm finished for the patients I treated, I will prepare full narrative reports on everything that happened to provide to the injured person's attorney. Then every other week that I am not treating patients, I am in a forensic medicine group evaluating injured persons, as I said, who were treated elsewhere, so that I can assemble important information, use my experience, and provide a report with my diagnoses, conclusions, and expectations. That was my time at Solmeyer's Medical Associates.
And now you're retired.
I am on pause. After many years as a New Jersey person, in November, I moved to Bluffton, South Carolina. And in time, I'll resume working as an orthopedic physician in South Carolina.
Is that where you are today, South Carolina?
I am on vacation in Santa Fe, New Mexico. And on the weekend, I return to Bluffton, South Carolina.
So whatever your fee is for today's testimony, that's not going to Solmeyer's, that's going to you.
That is correct.
What is your fee for today?
I know how much I'm receiving, but it's not my fee. I am receiving $2,000 for so much effort that I put into this because it's so important. I did not choose the fee because I am not experienced at this type of billing and receiving. I asked the plaintiff's attorney for all the work that's done and all that's involved, you please choose the amount that you feel is proper. And the exact amount is not important to me. Of course, I want some amount, but I just want the proper amount.
So Mr. Perez decided what your fee would be for today and he landed on $2,000?
Correct. Not for today, for this, I've been very much preparing myself so that I could be as clear as possible to the attorneys and to the jury.
Off the record? We go off the
Bobby,
record?
the time is 3:03 off the video record.
Recording stop. Recording in progress.
Time is 3:04. We are back on the record.
All right. So, Doctor, prior to taking that brief break, we were discussing your income for this particular case since leaving Solmeyer's. Forget about whether it's today or in preparation for today and whatever it may be. And the 2,000 number that you mentioned earlier on the record, that's actually a deposit, as far as you understand it, correct?
As far as I understand, but additional or no additional, as I said, is unimportant to me.
Whether it's important to you or not, your total fee, whatever it ends up being, remains to be decided at some point after today, correct?
Correct. And as I said, I would ask Mr. Perez, experienced at what's proper, to choose.
All right. Doctor, the first report that you authored for Mr. Perez was dated May 21st, 2019.
Yes, that was the date of transmission. For the date of evaluation, April 25, 2019.
Correct. The date of transmission, at least, was approximately 6 weeks before the second motor vehicle accident of July 3rd, 2019.
Yes.
The date of examination was April 25th, 2019.
Yes.
And that was a little over 2 months, give or take, before the subsequent accident of July 3rd, 2019?
Yes,
When you saw Mr. Barton on April 25th, 2019, is that when he told you about his April 2019 emergency room visit?
no, he did not. As far as I know, he didn't mention that emergency room visit. Those records were transmitted to me.
When was that emergency room visit again? What was the date?
Yes.
April what?
I have it. Emergency room visit, Holy Name Medical Center, Teaneck, New Jersey, April 16, 2019.
So 9 days before Mr. Barton came to see you for the first time, he made that visit, but he didn't mention it to you?
Correct.
He testified on direct that in relation to that emergency room visit of April of 2019, you only have the discharge report. You don't have the complete chart.
Not a discharge report.
I'm sorry,
just
discharge instructions. I
Correct.
apologize. My mistake. And just to be clear, you only have the discharge instructions. And for the jury, those are the type of documents that if they were to go to the emergency room for something, those are typically what the hospital would give them to take home with them.
Correct.
And that's all you have for the April 2019 visit.
Yes,
And you said at some point, Mr. Barton himself told you why he went to that emergency room in April of 2019. Did I understand that correctly?
no,
I misunderstood. Did I misunderstand your testimony? He never told you about that visit?
no, I don't think he told me about that visit. I'm aware of the visit from medical records.
Um, you're free to refer to your report if you need to. I'm referring to it. You don't necessarily have to go by memory. Your May 21st, 2019 report. And this report has line numbers to the left. Do you have those?
I have it.
At about line 23 on the first page, it indicates that following the first accident, the one we're here for, Mr. Barton was examined at Edgewater Urgent Care. Do you see that?
Yes,
That examination at Edgewater Urgent Care was 2 days after the accident, correct?
yes,
Mr. Barton was not attended to by emergency medical personnel at the accident scene, correct?
correct. As far as I know.
Correct. All of these questions are as far as you know. I don't
Yes.
want you to speculate. And Mr. Barton was not did not present to a hospital or emergency room on the day of the accident.
As far as I know, correct.
The day immediately after the accident, Mr. Barton did not present to a hospital or emergency room, correct?
Correct.
On the day of the accident, the day after the accident, Mr. Barton did not present to a family doctor or primary care doctor.
Correct.
He did not call his family or primary care doctor.
Correct.
After that
Objection.
visit to,
And Bobby, the time is 3:10 off the video record.
Recording stopped.
Time is 3:11. We are back on the record.
doctor, after that visit to Edgewater Urgent Care 2 days after the December 14th, 2017 accident, Mr. Barton's next medical attention was with a chiropractor, Dr. Jacobs, correct?
I'm aware of Dr. Jacobs' first evaluation, January 19, 2018. So I am aware there was a urgent care visit and then a Dr. Jacobs.
So in over a month after the accident, there's one urgent care visit and then nothing until seeing Dr. Jacobs.
As
In
far as I
January.
know.
At line 37 of your report or thereabouts, you have a caption employment status. Do you see that?
Yes,
And it mentions that at the time of the December accident, Mr. Barton was self-employed. What was he self-employed as?
self-employed construction business.
And it says that because of the accident, he had to close his company. Did I read that
Is what
correctly?
he told us on that date.
Do you have any information?
Evaluation.
Do you have any information regarding whether and or why he closed his company other than him telling you that in April of 2019?
No,
Do you have any idea how long after the accident he closed his company?
no,
Do you have any idea if he continued to work for some period of time immediately following the December 2017 accident?
no,
On line 53 of your report. Actually, we'll start at line 52. It's on page 2. Are you there?
yes,
It reads, he loses his balance at time and walks with a limp. He wears a back support and uses crutches at times. You didn't see any doctor prescribing a back support or crutches to him, did you?
no, those were his words to us.
And when he came to see you, he wasn't wearing a back support, correct?
No,
And when he came to see you, he wasn't using crutches, correct?
correct.
Did he happen to mention to you, or maybe did you ask him one way or the other, if no doctor prescribed a back support to him, where he got it?
Personally, back supports are a personal choice, and I myself did not tend to prescribe them. It's often the person choosing one on their own.
Where did he get the crutches?
A physician or a chiropractor could have prescribed and recommended them, or he could have chosen them on his own.
But just to be clear, you didn't see anything in the records that a physician or chiropractor recommended them, did you?
Correct.
Line 172 of your report, I believe it's on page 4. You see that?
Yes,
It says the patient first sought treatment on December 14th, 2017. That's wrong, correct?
correct.
On page 194 of your report, I believe it's on page 5. You see that?
Yes,
You were talking about Mr. Barton's residual limitations as of April 2019, and that they were going to have a substantial impact on his future ability to participate in activities of daily living that he has identified without pain and discomfort. What activities of daily living were you referring to there?
he states that he has difficulty. He told us the activities of daily living that were caused with difficulty. He said he had difficulty sitting, standing, driving, bending, lifting, working, reaching, and sleeping.
And I think we may have implied this earlier, but just to be clear, since you were not a treating physician for Mr. Barton, you didn't prescribe any medications for him, did you?
No, I was not a treating doctor and prescribed nothing.
You didn't prescribe any medical devices or durable medical equipment for him, did you?
I didn't, no,
You didn't recommend or prescribe any modalities or procedures for him, did you?
no,
And by the time, or I should say at the time, you saw Mr. Barton in April of 2019, he hadn't had any active treatment for some time, correct?
Let's see. His last pain management procedure before my evaluation was October 3rd, 2018.
Okay, so about a little over 6 months before you saw him.
But that is not a large amount of time from a clinical point of view.
Then, as we stated, a couple months, a little more, about, I guess, two and a half months after you saw him, he got in another car accident.
Yes,
And that was the next time he had any medical attention after that accident, correct?
yes,
And you were shown photographs purporting to show the damage or lack thereof caused to the vehicles involved in the second accident by Mr. Perez. Do you recall looking at those?
yes, but I want to state they were somewhat important, not as important as the continuation of the same difficulties and the same pathology.
How much damage was there to Mr. Barton's vehicle in the first accident?
I heard moderate.
Okay. Never saw any pictures from that one, did you?
No,
Your second report to Mr. Perez, Mr. Barton's attorney, is dated March 23rd, 2021, and it covers a visit you had with him the day before.
yes, March 22, 2021.
Can you go to line 93 of that report? I believe it's on page 3.
Yes,
You see there in that section, it starts, according to Ricky Barton, he relates a motor vehicle accident on July 3rd, 2019. That's the second accident, right?
yes,
And he told you that he injured his neck and back in that accident, correct?
yes,
He was examined by Dr. Waldman,
yes.
and that was in relation to the second accident, correct?
After the second accident.
Well, let me just read your report verbatim here. According to Ricky Barton, he relates a motor vehicle accident on July 3rd, 2019, involving injury to his neck and back. He was examined by Dr. Waldman, who recommended physical therapy, medications were prescribed, and MRIs of his neck and back were recommended, which was performed. He was also examined by chiropractor Dr. Wraith, who treated him. I think you meant to put with there, but it just said who treated him chiropractic therapy. All of that was done, as far as you knew, as of that day in response to the second accident, correct?
After the second accident.
An EMG was performed by Dr. Bilbo after the second accident, correct?
Yes,
Dr. Waldman administered an L5-S1 epidural steroid injection, bilateral L5-S1 selective nerve root block injection, cervical epidural steroid injection, and bilateral medial branch facet block injections at L3-4, L4-5, and L5-S1 levels. That's all
yeah.
after the second accident, correct?
yes, that's true. All of those things were done after the second one.
Dr. Waldman performed an L2 through S1 discogram after the second accident, correct?
Yes,
And then the back surgery, you referred to, I think you called it you referred to it as a disc removal. That was on November 5th, 2020.
yes,
So that's about a year and a half after the second accident, give or
Yes.
take, correct?
let's see. The second accident is summer. So yes, about 1.5 years.
So based on your examination and review of the records prior to Mr. Barton having that back surgery in November of 2020, you would have expected him, and he told you that he was really limited in his daily activities, correct?
After my first evaluation, he was limited.
Okay. So if we were to, hypothetically, if we were to go out, if we were able to have gone out and gotten kind of a snapshot day in the life of Ricky Barton in between his July 2019 second accident and his surgery in November of 2020, you would have expected him to have an antalgic gait.
Objection.
Maybe yes, or maybe no.
And an antalgic gait, you described it earlier and why it happens, but that's basically a limp to the layman.
Yes, but a limp can be for many reasons. A knee injury would give us an antalgic gait, where we'd want to spend time on the well leg, and we would unknowingly reduce our time on the other leg. For this case, it's related to back injury and nerve compression.
Would you have expected him to still be losing his balance in between the second accident and his back surgery?
If one leg is not working well, that is a common word that a person uses. Whether they're likely to fall or not, they often say, I don't have good balance, or I'm losing my balance.
Would you have expected him to be wearing that back support that he picked up for himself in between the second accident and the back surgery?
For ongoing back pain, yes, many choose to use it, many choose not to use it, and I don't personally prescribe them or recommend them.
Would you have expected him to be ambulating with crutches in between the second accident and his back surgery?
I have seen adult persons with disc herniation, impinging on nerve, use, even without a prescription personally, cane or crutches, sometimes with prescription. So yes, not unusual.
Would you expect him to have been performing construction activities between his second accident and his back surgery?
If there's anything he can do or try to do, if he's an owner, maybe he can. I guess that's good if he's trying to maintain an urge of living. But I know he's injured.
Do you know whether he was working at that point in time?
I don't know.
Between the second accident and the back surgery, would you have expected Mr. Barton to be carrying around construction materials like boards, 2x4s, those types of things?
That wouldn't be easy.
In between the second accident and the back surgery, would you have expected Mr. Barton to have difficulty getting in and out of cars and trucks?
Yes, it would not be expected to be smooth. It would be altered, I would expect.
In between the second accident and the back surgery, would you have expected Mr. Barton to be able to climb ladders? And just to be clear, I mean like extension ladders, not little step ladders you have around your house.
If he did, he's determined. Everyone's different. You cannot say expected or unexpected. People have to earn a living.
Would you have expected Mr. Barton to be able to walk around on a pitched roof in between his second accident and his back surgery?
He could have done it, but I wouldn't recommend it.
Again, even less physical activities than we just went through, he told you he couldn't do, correct?
Oh, he told me he had difficulties with them, with activities. He didn't say he couldn't do those activities.
And doctor, just to be clear, the timeline here. Mr. Barton was involved in the accident we're here for on December 14th, 2017, correct?
Yes,
Had an urgent care visit 2 days after the accident, correct?
yes, that would make it December 16, 2017.
Then nothing for a month, correct?
Correct.
Came to see you in April of 2019, correct?
Me, April on a certain day, 2019 for evaluation.
At that point in time, he hadn't had any active medical treatment for approximately 6 months, correct?
Correct. After pain management treatments.
He continued to have no active medical treatment for the next 2.5 months, correct? After seeing you.
Oh, I'll look to see the when Dr. Waldman begins. He had a lumbar procedure, we said together, November 2019. So that's months after the July 2019 accident.
And earlier on direct examination, when you were making distinctions between the pre-2019 treatment, pre-2019 accident treatment and post-2019 accident treatment, you called the pre-2019 treatment low invasive, correct?
Yes,
After the 2019 accident, the treatment became invasive, correct? High invasive, in fact.
no, not high invasive, thank goodness. They were the low invasive, and you could call it the minimally invasive method of discectomy, not high invasive open surgery. The Dr. Waldman, I feel, made a very good choice in removing the disc in a method that is called, we've heard of that type of surgery called minimally invasive. So the word high invasive cannot be used.
Did I understand you correctly on direct examination that it's possible that the second accident did have some lasting impact on Mr. Barton?
Yes, it is possible. I can't quantify it. I
And
can only speculate, but the possibility is more than zero.
okay. But even though that possibility is more than zero and you can't quantify it, you're going to stick to the conclusion that the first accident is 100% responsible
Yes,
for all of his problems?
the final diagnosis of Dr. Waldman is the same as the first pathology. You can put other percentages on it if you want, but if the first one had not happened, then, and what we know about even vehicle photos, if the first had not happened, there's a good chance, or in all medical probability, this person would be functioning well, and work included, because he was functioning, as far as we know, correctly before that first accident. So that is why I can't with medical certainty say the second accident made it worse. The second accident did not make it worse. I can't state that, but I can state with certainty that the first accident made the pathology that received treatment in the first segment of treatment and in the second segment of treatment. That's why I made that conclusion.
And as of today, you haven't seen Mr. Barton in coming up on 2 years.
Correct.
All right. Thank you, doctor. I have no further questions at this time.
I have some follow-up questions, Doctor. When you testified that Mr. Ricky Barton underwent treatment after the July 3rd, 2019 accident, you made a distinction between in response and after. Can you please explain to the jury what that distinction is?
Yes, I have no way of knowing if the second collision added harm to his structure. But I know the treatments that happened afterward are in response to the pathology that was present before the second incident. So
Okay.
I cannot call it anything but an incident, and I can only call the others management.
Fair enough, Doctor. You were presented with a series of far-fetched hypotheticals regarding what Mr. Barton may have done, could have done, did do, contemplated doing. Now, isn't it true that Mr. Barton underwent a rhizotomy on September the 5th of 2018?
2 rhizotomies were done about that time.
Okay.
One to the left, then another date, one to the right.
Is the purpose of that rhizotomy to make it to give him more pain or to take away the pain?
It's to lessen pain of the
lessen.
of
To
the
lessen
facet
pain.
joints. Yes.
So would you be surprised if in a hypothetical world described by defense counsel that Mr. Barton had a little bit less pain after the rhizotomy?
Oh, I hope that at least for a period of time he has less pain.
Now, rhizotomy, just to be clear, provides only temporary relief, correct?
Yes, temporary.
Okay, is that relief measured in years and months?
Months.
Okay, so it's not surprising at all, doctor, that Mr. Barton would have less pain after the rhizotomy, correct?
True.
Now, you testified as well that you reviewed some records, which indicate that Mr. Barton underwent a series of epidural injections after the 2019 accident, correct?
The series would, I believe, if I read well, it's one at the lumbar and one at the cervical.
Okay. Now, these were performed by Dr. Waldman, correct?
Yes.
Was he bored?
Say that again.
Why was he just looking for entertainment? Why did he perform these epidural injections, Dr.
Everything
Waldman?
I've read about Dr. Waldman's office visits is a sensible, caring, experienced physician. If you want to know more about him, he's the medical director of his group. If you want to read
Thank you, doctor.
things that people.
And is it fair to say, doctor, that Dr. Waldman, in performing these epidurals, in fact, wanted to alleviate some of the pain?
Correct.
And would it surprise you if Mr. Barton, after these epidurals, would have less pain?
I hope for a period of time there is less pain.
And he would be able to perform some of these activities in defense counsel's hypothetical world, correct?
I don't know. As a practitioner, we have seen everything from persons who use restraint and for persons who are more determined to do things. There's no special pattern of what people do, even with injury.
Okay, doctor, but these epidural injections are temporary, correct? They're not a permanent solution to the problem.
That is correct. They are temporary.
Was the discectomy a permanent solution?
Oh, it's a permanent reduction of displaced disc material bumping and bruising the nearby nerve roots. But it cannot, the disc material cannot be put back into place, so that disc can never do its amazing function. Earlier, I described how amazing these structures are. So that disc will always be harmed. Also, even when the disc material is removed, because it was herniated, you lose the space. So the foramen, which are the exit spaces, are not as open. So now the herniated disc may not be bumping and bruising nerves, but in the exit spaces are permanently inadequate. So that would mean this discectomy is very important to remove the greatest cause of nerve bruising and encroachment, but nerve bruising and encroachment will continue.
So that your testimony, doctor, is that this discectomy will alleviate some of the pain, but
Yes,
that Mr. Barton will continue to experience some limitation permanently.
correct.
No further questions.
Nothing further. Thank you.
Thank you so much, doctor. We'll communicate.
That concludes this video deposition. The time is 3:37. We are off the record.